Have you found working in the clinical setting that, because I know staff may be hesitant to educate if they're not an educator? One, kind of a two-parter here. Have you seen that in your experience? And then how do you get frontline staff comfortable with providing education or promoting the patient to seek education?
So, working with healthcare professionals, including pharmacists, I can see the nervousness of trying to educate the patient on
Mhm.
all the things that they're dealing with that specific case. I think the challenge is that these healthcare professionals speak very high level, but I wouldn't take that away from trying to provide them with some type of health education prior to leaving. There's been many times that I've left doctor's appointments that I should have had clear education versus just handing me a piece of paper, assuming that I understand this information, even if it's written. And so doing just anything you can to educate your patient and asking them, hey, is this clear? Do you really understand what I'm like asking you? Because people say, yes, they understand all the time and they leave. I don't know what they just talked about.
Yep.
And I think it's really important and really a duty of our public health and healthcare professionals to make sure that when that patient leaves that room, they have a clear understanding to the best ability of what they're supposed to be doing to improve or manage their health.
That's a great point. There's the difference between teaching somebody so that they understand and then teaching somebody so they can't misunderstand. Sometimes we hit on the first one, but very rarely do we go as far
Mhm.
as making sure this cannot be misunderstood.
Yes, it's just dangerous. And then not putting the accountability on the children of families who are not English speakers. I've seen that a lot. Make sure your mom takes her medication and you don't know the trauma that causes a child who
Or
doesn't even know how to read that label either. And so really making sure that staff are fully equipped, right? Is having the appropriate translator there
Mhm.
to ensure that they have clear understanding. That should not be the task of that child there whatsoever.
Completely agree. There's a lot of cultural components that can go into that. And that may not
Mhm.
be the dynamic of the family to say, hey, mom, you need to take your medicine, or dad, you need to take your
Mhm.
medicine.
Yes, exactly. Yeah.
Those are harder hurdles to overcome. And I think, unfortunately, we leave that a lot to patients where we say, all right,
Mhm.
you got to figure this out. When you get home, you got to figure this out.
Yeah. And I think that the intention is well, hey, make sure your
Mhm.
mom takes her medicine, but it's deeper than that for these babies who see their parents struggling, right? Who see their parents in and out of the hospital, seeing their parents taking endless medication. So we have to like be mindful with the high patient load, that intention between each patient and the cultural competency. I know it's a lot of different patients every single day, but it's always that one patient that you need to definitely make sure you're paying attention to and not traumatizing or not meeting their needs. Definitely value the work that the healthcare professionals are doing every day.
Yeah, they do a tremendous job. And it almost sounds like there's an opportunity, whether that's through a community health worker, a dedicated educator to do, whether it's a
Mhm.
house call or whether it's a stop in visit, or
Mhm.
you're going to go here for an education session about your current condition. Some of these are
Yes.
lifelong conditions, and you
Yes.
may have
Yes.
received, I think diabetes is obviously the most common and probably, you know, you may
Yeah.
not receive a lot of education on your first appointment.
Yeah.
May be required to do a lot of work between now and the next time you see a doctor or even a diabetes educator. So it
Mhm.
sounds like there's certainly a gap.